Um, okay. Someone will drown about once every minute this summer. Would you guys know what to do?
Yes.
Okay. CPR. It's a procedure used when a victim has choked, drowned, and I will later speak about other problems. We should all be alerted because we can save the victim's life. I have credibility on this topic because I researched for a whole week. So by learning CPR, it will better our understanding and hopefully it will make you guys want to learn how to do CPR. Okay, first I will speak about what CPR is and the problems that require us to use CPR. Then I will speak about a solution. Lastly, I will speak about why CPR is important to be learned. Okay, CPR stands for cardiopulmonary resuscitation, which is a technique. It can be either mouth to mouth or mouth to nose. You also have to compress the chest. So, choking, drowning, heart attack, suffocation, overdose of drugs, electric shock, and allergic reactions, CPR can be used on those types of problems. Okay, according to the American Heart Association in 2000, I erased it. Sorry. Okay. So, most people panic. They don't know what to do. So remember this: if no CPR procedure is done, the victim can possibly death or major damages. Solutions to our problems. CPR is our best solution. Unfortunately, I couldn't get hands-on, but I did come across some good videos, so I'm going to kind of show you guys. Okay. Okay. So CPR can be used infants, adults, and child, also pets. You guys didn't know. According to Sabardo, Linzinski, and James in 2009, who worked with the American Medical Association, in the Handbook of First Aid and Emergencies, they said that 30 compressions and 2 rescue breaths. Okay. So, I hope you guys can see me. Okay. So, I'm going to show you guys now. But before I do you guys know what to do would you guys know what to do if you see a drowning or choking person? Call 911 first. It's better if somebody is with you so you can perform CPR and the other person can contact help. So, according to Dr. Oz, who in May 26, 2012, who is a thoracic surgeon, the article is titled as ABCs of CPR. Save a life in 60 seconds. Do you guys know what ABC stands for? No. So, A, you want to tilt. A stands for airway. So you want to tilt the victim's neck gently. So you want to check their breathing, airway. You want to clear anything that's in the way. B is for breathing. You want to check if they're breathing, if their lungs are, If not, then you must start doing CPR. Okay. The last would be C, which is circulation. You want to check for the victim's pulse. If not, then you start. So this is victim number 1. Hopefully there's not any more. Well, you guys will hear a clicking sound. So you want to kind of like use your palm like this. And you want to pump 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, so on to 30. Then the first breath. You don't want to do it fast, and then you continue doing the second. You can do this until the paramedics or someone comes. Now that I just spoke about how CPR can help us with the problems that I presented earlier, I will now move on to why is it important to learn CPR. Like, many people don't know how to do CPR. According to Centofani in March 11th of 2013, in an article named "Many Americans don't know how to perform CPR." She kind of cited the American Heart Association, which said that about 70% of Americans don't know how to do CPR or have forgotten, which says that 30% of us know how to. So, learning is the best. It can happen to anyone. It can happen to your friends. It can happen to you. It can happen to family. We should all become heroes by saving lives. Now I just spoke about why CPR is important. Now I will move on to conclude my speech. Now you have a better understanding of CPR, and hopefully you guys want to learn CPR. First I spoke about what CPR and the problems we face that require CPR. Then I spoke about CPR and what is CPR. Then lastly I spoke about why is it important for us to learn CPR. So, choose mouth-to-mouth or nose-to-mouth resuscitation. Be a hero. Save lives.